Whenever you're scared to close a door somewhere, you feel like it's right, but you have to leave that job, go part-time or transition to somewhere else. Listen to yourself and honor that. Because whenever that door closes, another one will open. It absolutely will. For anyone in healthcare, you're successful already. You know how to be successful. You've proved to yourself. A very small percentage of people have gone through this training. So do it. Trust yourself and walk through the next door that opens.
Hello, everyone. Today I am interviewing Dr. Chrissy Guidry, aka Dr. Chrissy. And Dr. Chrissy's journey, she created Whole Body Optimism, which began with her experiences as a trauma surgeon and her growing awareness of the challenges faced by healthcare professionals. In the high pressure environment of trauma surgery, she witnessed firsthand the toll that demanding healthcare roles can take on both physical and mental health. Despite the focus on caring for others, many healthcare professionals often neglect their own well-being. The turning point came when several of her close colleagues experienced infertility, largely due to prolonged stress and neglect on their health. The incident highlighted the urgent need for a holistic approach to wellness, specifically tailored for those in demanding healthcare field. She realized that while medical training equipped us to care for others, there was a significant gap in how healthcare professionals cared for themselves. This gap was not just in physical health, but also in mental and emotional well-being. Witnessing the burnout, stress, and lifestyle-related health issues among her peers, she felt compelled to take action. Whole Body Optimism was born out of the need to bridge this gap. The goal was to create a platform that not only focused on physical health through clean living and nutrition, but also addressed mental and emotional effects of our environments. She wanted to offer tools and resources that were easily accessible and tailored to the very busy lives of healthcare professionals. The goal through this platform is to provide healthcare professionals support and resources to help them lead healthier and more fulfilling lives. Thank you so much for being here.
Thanks so much for having me. It's a pleasure.
Wonderful. I would love to hear a bit more about your journey specifically into the field of medicine.
Yeah, I'd love to share. I originally got interested in medicine because on Christmas morning, whenever I was 10 years old, I had my appendix out. I was caught off guard by this because I thought everybody was supposed to be happy, opening presents, like Christmas Eve. We always get together with, whenever I was young, we got together with my mom's family, and I was just miserable. I was having abdominal pain and everyone was just looking at me like, what's wrong with you? And lo and behold, the next morning when I still wasn't better, my mom and dad took me to the emergency room and I had appendicitis. That was a turning point for me. My dad was an ICU nurse. And so I saw him in and out of the hospitals. I admired healthcare and what went into it, but coming in from a patient perspective, I really got to appreciate what specifically a surgeon can do for me. I was in awe of this surgeon since a young age, and I thought, wow, can I actually do something like this guy? And ever since then, I've been really wanting to go into a field where I can make dramatic changes overnight. Always been wanting to do different science things. In undergrad, I did biological engineering because my mind thinks like an engineer. I want to make things better, engineer things. So that pushed me to be in more of a field where you can see things improve, not just like a medical side of things where you give someone a medication and you got to imagine what the things are going to be like in their cells and their molecular level, but a surgical experience. And for a surgeon, we see things from a mechanical standpoint, that things get better in front of us. And it just meshed well with my engineering degree. After that, I applied to go to medical school, and originally I didn't get in the first year I applied. That was pretty difficult at the time, but it really helped to open doors for the next phase of my life because I ended up getting my master's in neuroscience. and I got incredibly interested in the field of neurobiology and how our nervous system changes and our brain changes according to what we're surrounded by, and essentially our neuroplasticity. If you follow any trends out there, and the Joe Dispenzas and all these other famous neuroscientists, the Huberman Lab and things like that with biohacking, it really just is so in line with what I believe to this current day. If I would have gotten into medical school right away, I don't think I would have had that in-depth and breadth of knowledge about neuroscience and what the potential it has to change someone's life. So after neuroscience masters, I really did feel like I still wanted to go to medical school and got into an osteopathic school. I'm a DO, and I really enjoyed my training as an osteopath. We are provided an extra tool in our pocket, which is what a lot of people say is they teach us how to do manipulation, which is just a fancy and maybe a foreign word to a lot of people, but it's a chiropractic touch with a physical therapy flavor. Do I use those things today? No, but it helped me learn the body a little bit better. It helped me to learn the visceral somatics and again, that nervous system connection to our organs, our brain, and how the body is connected. I feel like that also helped me to have a more holistic viewpoint, how we look at things. And it's not just like medications and a simple fix. You really have to dig deep and have a more of a whole body approach. So then after that, I got really interested in anatomy lab. And as I tell my trainees now that I work with to this day, whenever something comes up in your past that you really get pulled to, your heartstrings light up, you get very excited. You go home that day and you call your mom or your dad or whoever that person is proud of you. And you could brag to that person about what you do on your day-to-day basis, but you're not going to talk to your friends or maybe even your siblings. You call them and you say, "Oh, anatomy lab was awesome. Like I knew what I was doing. I was the leader of my dissection table," things like that. Those kind of things you have to connect the dots. And this is where I believe mentorship comes into play. If you don't have a mentor telling you this, then you need to ask for more mentors or find another mentor. Your mentor should be telling you the things that light you up during your day-to-day activities in medical school, on rotations, even when you start residency. Those are the things you should be doing more of in your future life. It was a natural progression for me to think about anatomy. I should probably do general surgery. So during my general surgery years, I got challenged the most in critical care. What a lot of people don't realize, and maybe medical students don't realize, is trauma surgeons, there's no board certification for trauma surgery. There is a board certification for critical care surgery. And you can only get critical care surgery if you have a prior board certification. So you have to be an American College of Surgeon boarded general surgeon. That's the track that I went to get the critical care surgery board certification. I'm a trauma surgeon, yes, because that's our title, but really we're critical care surgeons. And there are some trauma surgeons that don't have critical care boarded, but they're still trauma surgeons too. It's confusing, but long story is that most trauma surgeons deal with critical care patients. The knowledge and the breadth and the depth of what you have to know to be able to take care of a critically injured patient was very appealing to me because I knew that if the sickest patient came into the hospital, I can put myself in a position where I can learn and train to know all this information to be able to give my best to that patient. Then I wanted to sign up. I was like, that's what I want to do. And that was where my training took me. I did research in my general surgery training, which I think really set the stage for me to get the fellowship that I really wanted, which was at LA County in Los Angeles, which I think is the best place to train for trauma because there was just such great mentors there. And then it set me up to get the job that I had when I first came out of training, which was at Tulane, a big academic institution in New Orleans. I really enjoyed my time there, but toward the end of my time at Tulane, about 6.5 years into it, I decided that I had to branch out and start my own company because there was a lot of things I was seeing in the healthcare world that weren't aligned with what I thought people needed to do for themselves and treat themselves. Early on in the pandemic, March 2020, I started realizing that I wasn't treating myself the best I could. That stemmed a lot from our battle with infertility. You really get a wake up call whenever you've achieved so much in your life, finished surgery, you're a trauma surgeon, you got this academic job, you think you're on top of the world. I found my husband, we got married and had a house and all these things. Then you have this bomb drop on you that is, oh, you can't have a baby. And then that's whenever I started discovering, you know what, like I need to clean up a lot of things in my life. I've always been healthy and like eating green smoothies, doing these things, but I wasn't as mindful about the little things in my life, like the plastics in our environment, the creams that I was putting on my body. I didn't realize that a lot of these things had a lot of endocrine disruptors that were messing up my hormones. And I didn't realize a lot of the things that I was reading and believing and seeing on social media were not good for my mind. They were talking about all these things in fertility should be triggers, and this should be a trigger, and not getting down to the root. I had a fertility coach in our surgery department that really helped me to see the other side of this and see that these things were happening for me. They were not happening to me, they were happening for me. And that was a big aha moment for me when I started realizing that suffering has a meaning. And when you can put a meaning to your suffering, not everything happens for a purpose. Think about it at a granular level. The bad things that have happened to you have a specific reason for you to awaken, to be enlightened, to make a difference in the world. Then you have a completely different outlook on how you can use your story to impact, motivate, and encourage others. And so I just thought this is silly that I'm going through this alone. I have got to get my story out and encourage other people. You don't have to tolerate what you're doing, and you could clean up your lifestyle, your mind, your body, and your soul and live such a better life, a life full of vitality, full of energy, full of kindness, full of love that you have never experienced before. And so that's whenever I started Whole Body Optimism. And obviously, like I have my podcasts, my digital courses, and I work with some group clients every once in a while. I have to space those out because I still take trauma call and I work part-time as a trauma surgeon and I maintain my certifications. I love mentoring medical students and residents. We're still on the fertility journey and our next step is donor eggs. I want people to realize that's still a way to become a mother. You don't have to let society and external factors tell you that if you're not healthy enough or not doing things right, those are the reasons why you're not conceiving naturally. There is a misconception in that because when you feel called to have a baby a certain way, whether it be adoption, surrogacy, donor egg, donor embryo, and all these things, and any kind of other way, again, these are happening for you. Put meaning to that event in your life. If you don't even want to call it suffering, because a lot of people are like, oh, I'm not suffering. But then what is it? So that's my journey. Long answer to your question, but
No, it wasn't long at all. I loved how you took us through the journey because that's exactly what it is. Everyone has a journey, everyone has a story. Oh my goodness, so many amazing things you mentioned. The first thing I want to say is that light you mentioned of what gets you excited and following that call. I think that is something that sometimes we struggle with articulating, especially when medical students are trying to decide what's path to go to. And I really like that you said, like, what lights you up.
I always tell medical students when you're evaluating rotation, I want you to journal. Take a piece of paper and write down at the end of your rotation, did you become a better version of yourself? Even if it's to your family, to your friends, were you nicer to people? Did you feel like you were just displaying this amazing version of your authentic self during that rotation? If you weren't, write that down too, and you cross that specialty off the list.
That is such great advice. Thank you. I think that is the authentic, being able to really, I think that kind of goes into like your meaning making of
Sure.
finding individuals' purpose in life and taking different challenges that people encounter and turning them into a purpose. Not everyone does what you and I do of making a podcast and telling everyone, but it's really cool to be able to determine when you're going to put meaning into it. I thought of, I don't know if you've read the book, A Man's Search for Meaning.
Yeah.
I just finished reading that book and I'm going into psychiatry. This concept of searching for meaning and logos therapy is what it is. I really find that also in your journey and how that was able to inspire you.
Definitely.
What made you do that switch to a part-time position? Because I've
Sure.
seen a lot of the individuals that I've been speaking on this podcast, the individuals who are now working, it seems to be a commonality going to this
Hmm.
part-time. I would love to hear what
Sure.
made that decision. How was it difficult? How did your colleagues take it?
Sure. Yeah, I would love to speak about it. And I think that more people need to take advantage of that. I think that when we finish training, we have this expectation that we need to make X amount of money. This is the elephant in the room. We all say we did this because we want to help patients. When you're done, there's a realization that you want to be paid for what you think you're worth. I totally agree with that. And you should look for that. A lot of times, we feel like we have to work harder to make more money. A lot of times we think money is the only way to show our value. That is not true because there is a thing called time affluence. When you have more free time to do the things that bring you more joy in your life, that will make you more wealthy than any dollar bill can. When you're looking at things like, okay, this job pays X amount of money and I have to work 4 clinical weeks a month. That's a lot of work. And you have to say, when you're saying yes to something, you're saying no to something else. So for me, whenever I was going to be very clinically busy in full-time position, and I had a role as the graduate medical education well-being director, that was taking up some of my time. I was meeting with the residents, trying to find out what brought them life and meaning at work and how can I make it better. I was really pulling away from my personal life. And the fertility journey takes up a lot of your time. And it could be an ultrasound at 7 a.m. I remember one morning I was covering the trauma service and I was supposed to cover an amputation revision, not a big case. The clinic called me and said, you need to be here this morning and have an ultrasound because we need to time out your retrieval and all this other stuff. I asked one of my partners, he was more than willing to cover. The case rolled and the nurse couldn't read the resident's change of consent to my name to my partner's name. So that delayed the case. The patient was intubated and they wouldn't let the other surgeon start the case. That led to her writing me up for not doing the case I had originally said I was going to do. Coming back from this appointment that was 10 minutes at max, I couldn't do the case. It was a simple revision. I had to explain to some peer messenger why I increased the operative time for a patient and all this other stuff. Multiple things like that kept coming up, showing me that the door was closing to that one hospital. I felt like this was the gauge of my success to work at a level 1 trauma center and do all this trauma call and all this other stuff. I was like, you know what? Things are happening for me. I need to take a step back and let that door close. If another door opens, I will walk through it. And that's when this opportunity, actually, one of my previous residents was the trauma medical director in North Carolina. And she said, hey, do you want to come take some call with us? So I started going to North Carolina and started realizing, you know what? I can still find the joy that I can experience in surgery. It just has to be a different setting. Maybe it's a different type of environment, the size of a hospital, working in a different kind of way and working part-time. And that allowed me to step back clinically and to really contemplate how can I help other people in a more global way than just that one singular institution? I felt called to go into the online space and sharing my clean living practices that I embodied myself and what I took that led me to the life that I have today and the freedom I have now. I'm taking this part-time position in Nebraska, and the doors just open up. And I would tell this to anybody, and I've coached a lot of people through job transitions. Whenever you're scared to close a door somewhere, you feel like it's right, you have to leave that job, go part-time or transition to somewhere else. Listen to yourself and honor that, because whenever that door closes, another one will open. It absolutely will. For anyone in healthcare, you're successful already. You know how to be successful. You've proved to yourself. A very small percentage of people have gone through this training. So do it. Trust yourself and walk through the next door that opens.
Beautiful. I love that. That's so meaningful, especially right now when there's a lot of transitions post COVID, going virtual, not going back if they were virtual for times for me and all my 2024 graduates going into
Yeah.
residency, specifically in these past couple weeks where a lot of people had doors open and close. Maybe they
Mhm.
thought they were going to a certain type of residency or a certain location, and I think that is so meaningful to remember that things will get better. You will be successful. It's just letting it happen
Yeah.
and trusting the experience.
Yeah, and receiving that it maybe won't be exactly what was on TV or
Mm.
what this facade of the perfect medical student has to be. Who cares? You'll be so motivational and inspirational to the generations to come if you do something not so cookie cutter. You don't have to work full time in the end. Like you could be impacting more patients, more healthcare providers outside of the traditional clinical model than you ever could have working your regular shifts at a hospital. So it's not like you're not impacting patients by not working quote unquote full time. And the people I work with now that are healthcare professionals, they're the ones making the impact even greater. So even though I don't have a direct impact on the patients they treat, they're happier, more lively, energetic, more vitality to bring to the patients they treat. And not only that, their families they go home to every night.
That is so important. And also, you sharing your journey on infertility, I think that's so powerful. I'm part of the infertility committee at AMWA. That's something that we
Nice.
talk about a lot, especially for surgeons, of how common it is for
Mhm.
infertility to be present because of all the years that you work, the ridiculous amount of stress on the body, standing for those long
Totally.
hours. It's interesting that you said that you went through the fertility stimulation process as you were attending, I'm hearing, or were
Yes,
you
yes.
still in school?
No, I was attending.
Okay, you were attending when you went through that.
My colleagues were like, "Can't you schedule that?"
Yeah. No,
And you
but
can't,
no.
yeah, you can't schedule it. That's a huge misconception. It's not like an elective procedure that you put on the calendar, show up and get your eggs retrieved. No, like we're in the process of going through different things to prepare us. It's taking months because you go and they're like, oh, you ovulated, so that messed up your lining. Like it's not that simple. And it's so important if you're listening and you want to be an ally to any women who are going through these processes, or any men who are actually working and their wives are going through this, to show a little bit of empathy in the process and just be like, hey, like you would treat someone so differently if they had cancer or MI or something. It's a disease. Like it's a problem. And we're the infertility world, we're embarrassed to admit it. We don't talk about it as much. That's another reason why I'm here, is just saying, no, we need to talk about it more, because the more we talk about it, the more it'll become a part of our normal culture. And so we can talk about maybe egg freezing earlier or things like that, that we can take advantage now that we know from the data that infertility risks are so high, especially in a surgical profession. If anyone's listening, I posted a reel about this recently. 1 in 4 female physicians have infertility, and 1 in 3 for surgeons. This is extremely high for us. They haven't put their finger on it. Some people say stress doesn't cause it. I have a hard time believing that. I think my body just got used to the stress, like the trauma alerts and things like that. If you ask me today, I say, no, my training wasn't stressful. But I think it's also a pride thing. As surgeons, we don't like to admit whenever we're under stress or over challenged. So I think that's been a huge part for me too, is this growth mindset to say, hey, it's okay to admit when you're stressed. It's okay to admit that you want to do something better in your life to improve your well-being. It's okay.
You make such a good point, especially the women physicians and women surgeons. There's this need to be strong. And I'm wondering how much ignoring our own bodily functions and ignoring how our body feeling and just pushing through
Totally.
have a long-term impact.
Totally. There's so many people, and there's studies that come out that say residents in the last trimester, they're having a lot of complications. I think that was a study funded by AMWA. Like this is a real problem. And I think some people are doing some really good studies out there. Erica Rangel, I don't know if you know her, but she's doing a great study with young new moms in residency where they're supplying them with mentorship, different wearable pumps, the little rockin' baby thing and all these things to really say, hey, can we make it easier for surgeons and surgery residents to have children earlier in their career and make it so that medical students like yourself could be like, oh, if these surgeons could do it, then maybe I could do it too. Because I think I talked to a lot of medical students that say, oh, I just don't want to do surgery because the schedule is hard. Now I know the fertility risk and I want to have a family. A lot of medical students now, this is their second career. They did something right after college that was music or arts or something, and then they switched to medicine. The most diverse people that do that, and they bring such a unique talent to the field of medicine, but that just means that they're a little bit older.
I would love to hear as we get closer on your thoughts on bringing in this diversity of opinions, diversity of ages, and even individuals who have health conditions in the medical community.
I think AMWA does a great job with doing panels and open forums to have that as a witness to other young trainees and medical students ask questions. I'm trying to do this back in New Orleans too, is just do some grassroots panels. Just like call like medical students who are interested in it, just tell them, hey, I'm not an OBGYN, but I know a thing or two about the patient side of infertility. And I'd love to be able to share this with anyone who wants to listen. Our AMWA chapter locally, the medical students do a really good job every year. They put on a fertility panel where some people that have frozen their eggs, some of the residents who have done it during their training, they come and talk. Some people who had children during residency. And so you have a whole breadth of different opinions. Whoever wants to talk about it, like I'm more than happy to do some kind of panel for you guys and set up some kind of conversation, because the more you talk about it, the more different people's opinions come out. You can increase that level of confidence that they have whenever they're like, oh yeah, maybe I wasn't going to go into surgery, but since I heard this, maybe we'll do it. This turned me on to it. When people inspire you and do things like this, or provide mentorship in that direction, and you just so happen to be there, it's not just a random occurrence, but it is synchronicity, and these people have aligned in your path, that is going to inspire you to want to go and do it. So if more diverse voices are out there doing this, that's the people that are going to encourage the young trainees, the young medical students to follow in their same footsteps.
Thank you so much. Conversations really do break that stigma down. And like you said, really can inspire others. It sounds like that's what you've been doing a lot of during your transition, whether if that was being a AGME for wellness or your podcast. I love seeing fellow physicians that I can look towards. I'm like, yes, I'm doing something right. It really helps so many individuals. As we wrap up, do you have any final pearls of wisdom? You've given so many, of course.
I would just say every few years or so, you really should sit back and reevaluate your trajectory in life. And I really do think every couple of years you should be doing something that challenges you on a mind, body, soul level. Is it your mindset that you're having a lot of imposter syndrome or dealing with? Journaling helps with this. Is it your body that you've given up on exercise? You are not eating clean. You want to reset. Just have this like every year, or even some people say 6 months, whatever works for you. And then your soul, like, how are you connecting with other people? Do you spend the time intentionally to call your loved ones once a week or things like that? So it really is a check-in that I encourage people to do. Maybe it's 6 months, maybe it's a year, maybe it's 2 years. Whenever you're younger, there's so many different moving parts. Things change more rapidly. Like every 6 months is a better way to look at it. Whereas when you get settled in your job, are you enjoying your job? Maybe you signed a 3-year contract or a 2-year contract. Look at it midway through your contract and say, hey, is this bringing me clarity? Is this cleaning up my mind, body, soul? Is this part of contributing to my overall well-being? Because if it's not, your cup is not going to be full. And when you serve other people and your patients, you won't be happy, because the happiness you will experience the most is when your cup is full first. You really have to embrace and realize that medicine is about serving others and putting the patient first. But I truly believe when your cup is not full, you can't overflow to anybody else successfully.
Those are such great points. Thank you so much.
Anybody wants to work with me or follow me or come in my podcast, like talk to me, listen to me. I have a podcast called Whole Body Optimism, specifically for healthcare professionals. My Instagram is also Whole Body Optimism. And then my website, again, wholebodyoptimism.com. Very easy to remember.
I can definitely feel the optimism. You definitely have inspired me. So I feel like our purpose and values very much align of the importance of caring for your own body fully. I love that mind, body, and soul, how much they are also intertwined. So I thank you so much for sharing that. And for the audience below, I'll make sure to share all the podcast episodes and the website and the social media. I appreciate Dr. Guidry so much for sharing your journey all the way from saying that you were so inspired from that appendicitis, seeing that surgeon save you and or say help you feel better. And then that inspiration, your excitement in medicine in that anatomy lab, choosing to be a surgeon, specifically trauma surgery and critical care, to use your experience in college with engineering, see that problem, fix that problem, and address it in the here and now. That is such an important field. And I also am inspired by what you mentioned of how you start to notice kind of your own body and taking a step back and realize that maybe it's time to take more time for myself, but still doing what I love, still being a trauma surgeon, just maybe take that step to close the door. And that is a very brave step, especially when in medicine, it's hard to say no. It feels like something's wrong with you, but it's just another door, another path. And even with your health struggles with infertility, you haven't give up and used it more as a way to support others in story and share your strength to help others and fight stigmas. So thank you so much for sharing your journey with us.
Of course. It was my pleasure. It was so nice to meet you.
Yes, it was wonderful meeting you. And I love to end the podcast just reminding everyone that they're not alone in their struggle. And that's why I share these stories, because I know when we're struggling, I've been there, you've been there, you feel very alone because people don't like to talk about the challenges, especially when it's happening. I hope that you remember that you're not alone in your struggle and to keep going. It will get better eventually. I hope that this provides either some inspiration or some motivation so you can continue. If you want more information on all the other episodes, make sure you're subscribed to Life as a Patient Doctor. We have other doctors, other medical students, other health professionals are really showing what it's like to take care of others, but also take care of themselves because they are human. I really hope to share the humanity in the health profession. And you can check out my website, MedPsychMoss. You can follow me on social media, MedPsychMoss. Thank you all so much, and I'll see you for the next episode.